right about yourself is so important. There's so many ways to do this. Diet and exercise are really important, but we're going to learn about a few other things that you can do. We're here at DermaSpa with Dr. Hollis.
Hello, Amy.
Hello, how are you?
I'm fine, I'm fine.
Good. Tell us a little bit about yourself.
Well, I'm a plastic surgeon, have been in Victoria for many years practicing as a plastic surgeon.
Right.
And part of my practice has involved what we do with our patients afterwards. And because of that, we get involved with DermaSpa. We started it up fresh 14 years ago.
So DermaSpa, is it a spa or is it a clinic?
It's both.
Okay.
It's both. It was a support system for my surgical procedures to help people maintain their good results, which they, of course, got from the surgery.
Yeah.
And it's evolved into more non-invasive procedures.
So meaning no knife?
Yeah, so I don't have to do the surgery quite so often anymore. A lot of facial corrections involve lasers, non-invasive lasers, and maybe minimally invasive injections such as Botox and fillers.
Right.
And these can be used for probably 20, 25 years before you need to have surgeries.
Wow.
You know, surgery may still be in the future, but so many people can make themselves look really good and feel good about themselves with minimally invasive
and it's not
procedures.
Quite as scary that way.
That's right, and that's where the clinic part comes in. The spa part, of course, we do manicures and pedicures and massages and hydrofacials, peels.
Making people feel good about themselves.
That's right, so that's where the spa part is. And the clinical part, or the clinic part, is where we do things that may be a little more medically orientated, such as lasers and even surgery. I do blepharoplasties or eyelid surgeries and minor procedures here in this room under local anesthesia.
So you do it all right here?
Basically, yes. Basically,
and you're talking a lot of about lasers. Is this a relatively new technology in the industry?
Lasers go back, practical lasers, back into the early 90s.
Okay.
And they were pretty aggressive back then, and they have been tweaked immensely so that we now have many lasers that do different things.
Right.
Some are good for superficial skin problems, sun damaged areas, pigmentation areas, spider veins. Also a little more aggressive lasers that will tighten the skin.
Oh, I like
that. Yes, so that you don't need the surgery as early as we used to. And also the lasers can be used on, for instance, on funguses on the foot.
Also important.
Which is nice.
And what are you seeing that's new and exciting in the industry?
I have been doing liposuction since the 1980s.
And liposuction, that's sucking the fat out.
Surgery, yeah. So we actually make an incision and we would aspirate the fat. Wow. And it works just great. But we now have non-invasive technology that we have right here at DermaSpa. You don't have to have an anesthetic.
Wow.
You don't go under the knife. And it addresses most body areas, the saddlebags,
is that something that comes back?
No, it doesn't. The fat is chilled to a point where it dies over the next 2 months, and then the fat's totally gone forever.
Wow.
Yeah.
Well, I like the sounds of that.
Yeah, so it can be done here just under a spa visit or a clinic visit with our staff, and we're really excited about this technology.
Well, I like the sounds of that. Let's go take a look.
Right, okay. Let's go have a look at the Coolsculpt technology we have here.
Dr. Hollis, you have a relatively new procedure here in the clinic. Tell us a little bit about it.
Well, we've had Coolsculpting for the last year, and it's a procedure that we use that's non-invasive, can be done in the clinic.
Okay.
And there's really insignificant downtime because there's no invasiveness to it. And it's for treating those troublesome areas of the body. It's not for obesity.
Troublesome how?
Troublesome in that you have bulges here and there, your love handles, the muffin top, maybe the tummy, even the arms. Most areas of the body can be addressed with this non-invasive technology, and it does it through applying a lot of cold to the fat. And the fat over the next month to 2 months after the procedure slowly dies. And about 25% of the fat that we have in the grip of our appliances that we put on the troublesome area goes. It's gone forever.
So you never have to have it done again?
No. If you have a lot of fat in one area, though, you may be a candidate to have it repeated
in a
year or several months later to do more sculpting.
Okay.
Yeah.
Well, we have Lisa here with us,
Yes.
who doesn't look like she needs anything done. She looks amazing.
Well, she's a perfect example of someone who can benefit from this because it is not for obesity.
Right.
Lisa has some body asymmetry that she would like to have corrected.
Oh,
so
okay.
she has more fat in one area of her waist on the left side than the other.
Okay.
So Lisa, show us if you can.
Well, I have a lot of fat on this side and not so much on this side.
Oh,
so it's like a
interesting.
shelf where I'm not asymmetric.
Right.
So I just want this area to
Little-
be treated
Yeah.
and to
Sculpting.
balance.
So this area is, as we can see, we can get a bit of excess fat here, as opposed to this side where there's less.
Oh, wow.
See, there's
That's
definitely
interesting.
less.
It's funny how our bodies work.
That's right, and that asymmetry bothers her. So we are going to treat this side. Now, we could treat both sides if someone was symmetrical and
Right.
had
Want to cut
excess
both
there.
down.
But it's also an area that can be used for the saddlebags, the inner thighs, the whole abdomen, for instance, the arm area. So
Which she doesn't need.
No, which she doesn't need. So it's a very specific sculpting.
I can't wait to see it working.
Yeah, well, we'll get going on it very shortly.
Okay, we'll leave you to it.
Okay, thank you.
Well, here we are checking in with our patient. You look relaxed, like you're having fun.
Lisa, how is the discomfort level?
It feels fine.
So that's what Coolsculpt's all about.
There you have
Non-invasive
it.
office procedure.
Well, thank you for having us.
And it works. You're welcome.